day everyone, I am Guadalquiver from BSN12L Group 46, and so for today I'm going to perform a property demonstration about the parenteral medication. So parenteral medication consists of the intravenous, intradermal, intramuscular, and the subcutaneous. However, in this written demonstration, I'm going to perform subcutaneous. Subcutaneous medication, this is used for insulin, and also this enters the body through the capillaries and the circulatory system. So first and foremost is we need to check for the doctor's order. Next is we need to check for the medication administration record. And check the label of medication carefully against the EMAR. This is to ensure that the right medication is being prepared. And also follow the 3 checks in administering medication. Read the label of the medication. So first, when it is taken from the medication card. Second is before withdrawing the medication. And third, after withdrawing the medication. And lastly, organize all the equipment to be needed. So we have the sterile water, which will serve as our improvised ampule and vial. We also have the syringe. We also have the cotton ball soap and dressing solution. We also have the sterile gloves and the waste receptacles. And also don't forget to perform hand washing and hand hygiene in order to deter the spread of the microorganisms. So I'll already close the door, face the curtains, adjust the room temperature, and provide adequate lighting for my patient's comfort and privacy. Hello ma'am, good day. How are you feeling today? Okay, great. So it is important to greet the client in order to establish a good rapport between the healthcare provider and to the patient. So ma'am, let me introduce myself to you. I am Guadalquiver and I am your student nurse for today. So may I know your full name please? When is your birthday? How would you like me to call you? Okay, great. So, Ma'am Jenny, the procedure that I'll be doing is I'll be administering you a subcutaneous medication. So, this medication will get entered to your body through the tissue layer between your skin and your muscle. So, this medication is used for insulin. And also, there are certain procedures that we need to follow. Is that okay with you, Ma'am Jenny? Any concerns or any questions? Okay, great. So, it is important to explain the procedure of the assessment to the patient so that they will know how can we participate on the assessment.
Now, select and clean a site. Select a site free of tenderness, hardness, swelling, scarring, itching, burning, or localized inflammation. Select a site that has not been used frequently. And thus apply clean gloves. As agency protocol indicates, clean the site with an antiseptic swab, start the center of the site and clean on the widening circle about 5 centimeters to 2 inches and allow the area to dry thoroughly. And place and hold the swab between the 3rd and the 4th fingers of the non-dominant hand or position the swab on the client's skin above the intended site. And discard the cotton ball. Now prepare the syringe for injection. Removes the needle cap while waiting for the antiseptic to dry and pulls the cap straight off to avoid contaminating the needle by the outside of the edge of the cap. And injects the medication. And discard the needle cap. Grasp the syringe in your dominant hand by holding it between your thumb and fingers with palm facing the side or upward for a 45-degree angle insertion or with the palm downward of 90-degree angle insertion. Using the non-dominant hand, pinch or spread the skin the site and insert the needle using the non-dominant hand and firm steady push. And removes the needle cap while waiting for the antiseptic to dry and pulls the cap straight off to avoid decontaminating the needle by the outside edge of the cap. And grasp the syringe in your dominant hand by holding it between your thumb and your fingers. Now, inject the medication by holding the syringe steady and depressing the plunger with a slow, even pressure. So when the needle is inserted, move your non-dominant hand to the edge of the plunger. Some nurses find it easier to move the non-dominant hand to the barrel, to the syringe, and dominant hand the end of the plunger. And inject some medication by holding it syringe steady and depressing depressing the plunger with a slow even pressure and removes the needle. Remove the needle smoothly by pulling along the line of insertion while depressing the skin with your non-dominant hand. If bleeding occurs, apply pressure to the site with dry sterile gauze until it stops. And discard. Dispose the supplies appropriately and assist the patient into a comfortable position. Flip the medication ticket if not using the EMAR. Do aftercare, remove gloves and dispose used items in appropriate waste receptacle and return other equipments and also perform hand hygiene.
So now, document all the relevant information, including the time of administration, drug name, dosage, and the route, including the client's reaction. And now, assess the effectiveness of the medication as it is expected to act. And that's it. That's my proper demonstration about the parental medication.